Hello, everyone. Today we're going to be presenting on stinger or brachial plexus injuries, and this presentation is by Stella Ewert, Maddie Everson, Sophie Schwartz, and Liz Walston.
The patient in this case study is Molly B. Molly B is a 46-year-old female who is an office manager. She is healthy and has no significant past medical history, but occasional neck stiffness related to desk work. Her presenting complaint is sudden onset of sharp burning pain radiating down the arm after a fall while playing recreational volleyball. Molly reports experiencing a sharp burning pain along the right side of her neck and down her right arm immediately after a fall during a volleyball match. While attempting to dive for the ball, Molly's head and neck were suddenly forced into an extended position with her right shoulder receiving a direct impact. The pain lasted for a few seconds before subsiding, but was followed by a persistent aching sensation and some weakness in her right arm. She describes her sensation as feeling an electric shock down her arm, which is a classic description of a stinger injury. Molly denied any loss of consciousness, dizziness, or other neurological symptoms.
To understand a stinger injury, we first need to look at the relevant anatomy and physiology. The brachial plexus is a complex network of nerves that plays a crucial role in controlling both motor and sensory functions in the upper limb, ranging from the neck and shoulders all the way down to the hand. It most commonly originates from the spinal nerve roots C5 through T1, but can move up one or down one, and these extend from the cervical spinal cord. These roots serve as critical connection points between the central nervous system and the peripheral nerves. The brachial plexus branches into several important peripheral nerves, including the musculocutaneous nerve, the axillary nerve, the radial nerve, the median nerve, and the ulnar nerve. These nerves are responsible for the movement and sensation of muscles in the neck, shoulder, arm, and hand. The spinal cord itself acts as a connection point between the brain and the rest of the body. It connects to the brachial plexus through the dorsal and ventral roots. These are part of each spinal nerve and help transmit the signals. In terms of function, motor signals travel from the central nervous system to the peripheral nerves, triggering muscle movement, while sensory information travels back from the body through the peripheral nerves to the central nervous system, allowing us to feel things like touch, pain, temperature, and much more. In a stinger injury, often caused by a sudden stretch or compression of the brachial plexus, these motor and sensory pathways are temporarily disrupted, leading to common stinger injury symptoms.
The pathophysiology of the stinger brachial plexus injury includes the stretching or compression of the brachial plexus, which is a network of nerves that originates from the spinal cord C5 to C8 and T1 and provides motor and sensory functions to the shoulder, arm, and hand. The injury typically results from forceful impact or trauma to the head, neck, or shoulder, causing a transient disturbance in the normal function of these nerves. Symptoms include burning or radiating pain, numbness or tingling, weakness, loss of coordination, and/or pain in the neck or shoulder. Key factors include mechanism of injury, which can be trauma or impact. A stinger typically occurs due to a forceful blow or impact to the head, neck, or shoulder, often in contact sports like football, rugby, or wrestling. Neck and shoulder movements is another mechanism of injury, which the injury often results from a sudden lateral flexion or extension of the neck, which stretches the brachial plexus. Compression is another mechanism of injury, which is a direct blow to the shoulder or neck that can compress the brachial plexus, pinching the nerves and causing pain and neurological symptoms. Forceful blow or impact to the head, neck, or shoulder, or sudden compression of the brachial plexus nerves during activities like contact sports is the primary cause of a stinger injury. Nerve disruption is another key factor, which is stretching or compression. The injury occurs when the brachial plexus nerves, which control the arm and hand, are stretched or compressed, leading to temporary disruptions in motor and sensory function. One last key factor includes recovery and duration of symptoms. Most stinger injuries are self-limited and resolve within minutes to hours with full recovery. However, in some cases, symptoms may persist or reoccur, requiring medical evaluation if the injury is severe or recurrent. The impact of brachial plexus injury, also stinger, is increased risk of permanent nerve damage, time out of sports and or work, and impact on everyday life and use of arms. The diagnosis of a stinger brachial plexus injury includes a clinical evaluation, patient history, which can describe trauma or contact and duration and onset of symptoms, a physical examination, which includes palpation of areas in the neck and shoulder, neurological exam that tests for motor and sensory function, and range of motion. Tests that may be included in a diagnosis could be the Sperling's test. This test is used to assess for nerve root compression. The patient's neck is extended and rotated to one side, and pressure is applied to the top of the head. If the test reproduces symptoms such as pain or tingling down the arm, it may suggest nerve root involvement, but it could also indicate a stinger injury. Another test would be the traction test, which is when the physician may apply a gentle traction to the neck to see if this exacerbates symptoms like burning or tingling down the arm, which would suggest a brachial plexus injury. A last test could be proprioceptive training. This focuses on improving the body's awareness of its position in space. Proprioception, which can help in avoiding further injury to the brachial plexus. Further tests could include imaging such as MRI, CT scan, X-ray, or EMG. Medical treatment for brachial plexus injury could include symptom management and monitoring, pain relief such as ibuprofen, Isar heat, or corticosteroid injections, rest, which could be involving avoidance of neck and shoulder stress and excessive movement and activity modification, rehabilitation, which may include physical therapy, occupational therapy, postural correction, and proprioceptive training. And lastly, for medical treatment, bracing or support may help, which would include a soft surgical collar or a shoulder sling.
When someone is dealing with a stinger injury, there are a variety of ways that injury can directly affect that person's ability to participate in everyday activities and meaningful occupations. Because a stinger affects the brachial plexus, it can significantly interfere with many daily tasks that require arm and hand use. Starting with ADLs, clients may struggle with basic self-care tasks such as bathing and toileting, especially if they have pain, weakness, or limited range of motion in the shoulder or arm. Dressing, particularly with fasteners or overhead clothing where they have to reach, and personal hygiene and grooming such as brushing teeth, shaving, or styling hair, all of which require fine motor control and shoulder stability. Moving into IADLs, driving may be difficult or unsafe due to impaired arm strength or reaction time. Tasks like meal preparation and home maintenance, like sweeping, vacuuming, carrying groceries, can all be challenging due to weakness or pain in that affected limb. When it comes to job participation, the impact can vary depending on what the person's occupation is. For office work or technology-based jobs, computer use and fine motor precision might be affected. If the job is more physical or repetitive in nature, tasks can become more painful or even impossible without accommodations. Leisure participation is also commonly affected. People might want to avoid or will have to avoid sports or recreational activities due to pain, weakness, or the risk of re-injuring themselves. Even more delicate hobbies like knitting, drawing, or sewing can be frustrating or unmanageable with impaired dexterity or grip. Lastly, for education participation, tasks like note-taking, typing, or writing may be difficult due to pain, poor coordination, or fatigue in that dominant hand or arm.
Occupations may change based on severity when it comes to brachial plexus injuries. There are 3 differing levels of severity when it comes to these types of injuries. A grade 1 brachial plexus injury involves disruption of nerve function and myelination, specifically axonal integrity. However, remyelination typically occurs within 3 weeks of the injury. A grade 2 brachial plexus injury involves axonal damage and Wallerian damage, which is nerve fiber degeneration. A grade 3 injury involves complete nerve transection, so the nerve is completely cut, and permanent nerve damage due to the injury. So not only does the severity affect how an occupation may change, but also the location and where that location affects. So the degree of severity and location will play a large role in how occupations are affected. Pain management is very, very important when it comes to these kinds of injuries, specifically relating to ADLs and other performance tasks. It's recommended that the PROM assessment is used to assess a client's feelings on their recovery, specifically related to how their pain is affecting their occupations. Sleep is another occupation that is greatly affected depending on severity. So, especially if this individual is a side sleeper on the side in which their injury is occurring, or really any type of support may be needed. There may be need to be recommendations for positioning of certain pillows for supports, maybe some rolled up blankets, really just adapting their sleep so they can get good quality of sleep through their pain and try to avoid as much pain as possible during sleep. External supports like the pillows and things like that may also be necessary during the day. Things like slings and braces can help to stabilize to assist with occupational performance, especially relating to ADLs. There's a lot of difficult and complex arm movements when it comes to showering, grooming, feeding, toileting. All of these things are going to be needed to be taken into consideration when considering the severity and location of the injury. What exactly is impacted? Is it grip strength? Is it elbow flexion and extension? Is it shoulder abduction and adduction? All of these things will need to be taken into account to adjust occupations.
Let's start with dressing and grooming. One-handed dressing techniques would be beneficial. For example, putting the affected arm into the sleeve first. We also recommend adaptive tools like button hooks or Velcro clothing to reduce the need for fine motor coordination. Long-handled combs and brushes can help people groom without lifting their arm too high, which can be painful or even impossible for some clients. For feeding and cooking, simple tools can make a big difference. Utensils with specific grips can help if the person has trouble gripping. A rocking knife allows one-handed cutting, and a non-slip mat helps stabilize plates or bowls on the table or counter. These small adjustments promote independence and reduce frustration. When it comes to bathing and hygiene, we suggest long-handled sponges, pump dispensers, or even electric razors. They all reduce the need for complex hand or arm movements. And for safety, shower chairs and grab bars are essential, especially if the client has limited balance or arm strength. In terms of writing and technology use, ergonomic pens and speech-to-text software can reduce strain. If typing is difficult, we might recommend a one-handed keyboard to make things more accessible. It is also important to incorporate education and activity modification. It is essential to teach clients how to protect their joints and use proper body mechanics to prevent re-injury. Occupational therapy would help look at how to adapt daily routines, work tasks, or even athletic techniques to reduce nerve stress. It is also important to gradually return to any physical demanding activity and not have the client overexert themselves. These are our references. Thank you so much for watching.